in the church, sometimes we talk about the tabula rasa. That means the blank slate. We start out a blank slate. But then people enter our lives, and we develop our values, and we begin to know what our strengths are. I taught all of the science. I was the department of one, the head of the department and the only one in the department, and so I taught all of the sciences, and it was a wonderful, wonderful feeling. The students were smart. They were so smart. We knew, we meaning the sisters, knew in our community was that there was a great need for health care.
One day, one of the sisters I lived with said, "Why didn't I become a doctor and open a clinic on Davis Avenue to help the people?" I thought it was a far-out idea, an impossible suggestion. But the seed was planted, and with the help and support of many people, I applied and was accepted into medical school at the University of South Alabama in 1974.
So they said to me one morning, "Why don't you go to this medical school and be a doctor and help these people?" Well, I thought it was the craziest idea I ever heard, because, I mean, I was a happy teacher. I really loved teaching, and I loved teaching high school children. But it's a pretty big leap to say, now why don't you go to medical school? And at that point, I was about 35. I thought it was insane. But they kept it up. They just kept it up. And I said, let me investigate this. And if God, because they said, what if God wants you to do this and you don't do this? I said, well, let me investigate. And if God is saying no, then you've got to let it go, because I shall continue to teach. But so I did investigate. Matter of fact, I went right to the dean of the medical school. And I said, here I am. This is how old I am. These are my credentials. I did have a master's degree in biology. I said, these are my credentials. And this is what I'll do if I do go to medical school. I'm going to start a clinic on Davis Avenue. So he was quite nice. He said to me, well, sister, that's very nice. He said, I'm going to be honest with you. You know, your age is probably against you. He said, but why don't you take the test? A test? I didn't even know there was a test. So there was this test called MCAT. But I didn't stop there. Matter of fact, I talked to the bishop. I went to the bishop and I said, can nuns be doctors? And one of my classmates was my own student that I taught at Heart of Mary, Harold DeClue. Harold and I continue to be very close. Matter of fact, he married his classmate from Heart of Mary, Joyce Casino, and who I also taught. But anyway, my classmates were very curious as to why I was doing this, you know, going through the torture of medical school at my age. So I told them, I said, this is why I'm doing this. I'm going to start a clinic on Davis Avenue. And they said, why? Why don't we do it? So I told them why. And then they said, well, let's do it now. And I said, you're missing something here. We're not doctors yet. So they said, we can do it. And I don't really know why I decided to go ahead with that, except they were very excited about it, you know, medical students, and they enthusiastic, and they wanted to help. And they said, we'll get doctors, we'll get doctors.
The original group of physicians who volunteered included a former dean of the medical school, a former president of the Mobile Medical Society, 4 faculty members of the medical school, and 4 black physicians.
Was so glad to have that opportunity that she recruited some physicians on a volunteer basis. And there were 4 of us, as I recall. Dr. Albert Thomas, Dr. Warren Foster, Dr. LeBaron Foster, and myself. There was a group of patients who were not being served for many different reasons. One was possibly the efforts to get to a physician. Secondly, worrying about the cost after having been served by the physician. And when they heard that it was free, you know, that's a big come on for everyone. And so that's how we managed to be able to take care of them. And the nuns were actually, canvassing the area to see who in fact did need medical service, regardless of what it was. See, they were actually canvassing the area to encourage the people to come to the center.
So first thing I did was I went to the Franklin Finley family, and I said to them, would you let me use that house, the house, the little house that Dr. Franklin had as his clinic off Davis Avenue. So Mr. Buskey became a friend. And when we started the clinic, we set it up as a nonprofit clinic, and we set up, we had to have a board to set up as a nonprofit. And so I asked Mr. Buskey if he would join the board. And he did, along with medical students and sisters. And there were many, many wonderful people on the board. And but it was a stroke of genius that we chose Mr. Buskey, because then he became a legislator from the state of Alabama, from the district that he lived in. And I'm pretty sure that he was also helpful then when the grant for 3 years, we had to find some type of funding for our clinic, our Franklin Clinic. And Charles White was able to get the federally funded, the clinic as a federally funded clinic, which was very rare to be in an urban area and have that designation. So that really helped to solidify not only that clinic, the first clinic, but then it expanded to across the street on Davis Avenue, and the big clinic is there. And then other clinics were formed, satellite clinics, in many neighborhoods, not only in Mobile, but in surrounding areas. And I was very proud to have one of them named after myself and Mr. Buskey, the Aiello Buskey Clinic.
Thank you, Mr. Speaker. I rise today to recognize Alabama State Representative James Buskey. Representative Buskey recently announced that he will be retiring from the Alabama House of Representatives after 42 years of representing people in Mobile, Alabama. He was first elected to the House in 1976, making him one of the longest-serving legislators in Alabama history. Outside of the legislature, Representative Buskey spent much of his life working in public education, including as a school administrator at E.S. Chastang Middle School in Mobile. While we have had our share of political differences, I have always appreciated his institutional knowledge and respected his passion for our local community. I'm honored to call James a friend and appreciate his decades of service to the people of Mobile and Alabama. Mr. Speaker, I wish James and his wife Virgie all the best upon his retirement and their years ahead together. And I yield back.
In our relationship, I went back to school at the University of Colorado in Boulder, and during that time, she was trying to go into medical school. She was going to leave the teaching profession and go to medical school, and I think somebody asked her what did she want to do, and her response was that she wanted to come back to the community, she wanted to come back to the Davis Avenue community where the Heart of Mary was, and set up a clinic. And in addition to that, let me tell you, whatever the number of years that Franklin has been in existence, I've been on the board since then. One of the founder members, and as well as one of the organizers, and presently still a board member. And I enjoyed every minute of it.
Good morning. One moment, ma'am. Miss Mosley?
Today, Franklin Memorial Primary Health Center remains a private, not-for-profit corporation established to provide primary health care services to the residents of this underserved community.
I would say, one, congratulations. Two, look at where you started. And three, look what you have now. I think Franklin is probably one of the most successful clinics in the state of Alabama. No, one of the most successful clinics in the United States. It has done a tremendous job in serving the people who come to Franklin, and with our CEO, Charles White, and his participation at the state level and the national level, Franklin has become a showcase, a model for what primary health centers ought to be. And so I would say, congratulations more. Look what you started and look at what you have now. Congratulations again.
He was the perfect leader to take over the clinic. He was a man of faith, a man of the people. He cared. He cared about the poor. He cared about those in need. There could not have been a better president of the clinics. He worked tirelessly. I know he did. I know how hard it is. And I will be eternally grateful to Mr. White, for the Reverend Charles White.
Probably thank you, but more beyond that, I'll give her one of the biggest hugs I can give her for the idea that she created that brought forth Franklin.
The board, the founding board of the Franklin Health Center Clinic, you know, they had a dream. We all had a dream. And without each other, without that board, they were willing to put their names and their reputations and their effort. It is not easy. I have been on boards. I was on a board in Jackson, Mississippi of a big hospital. It's hard. It's hard work. It takes time. It takes your time and your effort. And I am eternally grateful to the people, that's the founding board and the board that's there now, and the people that are there now, those who are now the medical people and the administrators and staff. The greatest blessing is that something continues on and the people are served. It doesn't matter really that I started it or that anybody else was there, but that the people are being served.